Okay, peripheral effects. On the vegetative system, we have the activation of biosynthesis of acetylcholine, serotonin, and histamine. That's why we have the symptoms of dry mouth, vasodilation of the conjunctiva of the eyes, redness, and itching of the skin. On the cardiovascular system, inhibition of conduction of myocardium, bradycardia, nervus vagus, remember, and increased cerebral blood flow, so will be the headache. On the GIT, it will be constipation plus cramps because of, I already said, we have contraction of the smooth muscles. Urinary system, reduction of renal blood flow, activation of secretion and the release of antidiuretic hormone, increased tonus sphincters of the bladder and uterus. So, what will be? Reduction of the urine formation and urinary retention. Yes, seriously, the urine will not go out. And on the myometrium, it will be decrease of muscle tone of uterus. Source of opiates. Opium is poppy seed juice. Okay, opium is grown in the okay, this information is not that important, I think. Oh, let's see what are the alkaloids. The alkaloids of opium are classified into two groups. The first group of alkaloids are phenathrene derivative alkaloids. They are morphine, codeine. They have analgesic and antitussive activity. Also, we have thebaine, the raw material for semi-synthetic opioids. And the second group of opium alkaloids are isochinoline alkaloids. They don't have opioid effect, they have only spasmolytic effect. They are papaverine, noscapine, and narcotin. Почему здесь так написано, не знаю. Loud music. Narcotin also we have. Okay, so you see guys, only in phenathrene alkaloids we have analgesic activity. Please pay attention on that. Analgesic activity only in phenathrene alkaloids. In isochinoline alkaloids, there is no analgesic activity. Pain relief will not happen. In isochinoline, only spasmolytic effect. Yes, pain will be reduced if the patient has a spasm. Okay. So let's go further. So morphine, as we already said, it is a phenanthrene derivative, the main alkaloid of opium, because it has a lot of concentration of this drug, 10%, named after the Greek god of dreams, Morpheus. So we have already said about that. The chemical structure was established in 1925. Okay, this is the chemical structure of morphine. Okay. Morphine poorly penetrates through the tissue barriers, but when acetylation in the body of 2-hydroxyl groups is converted into an active metabolite, diacetylmorphine, heroin. So, it is the synthetic drug, heroin, which penetrates through the blood-brain barrier. And in the brain, this drug, the acetylmorphine, is hydrolyzed back to morphine. So, heroin, I think everybody knows, is the drug which destroys the lives of many people in the world. In the United States, we have 1 million consumers, and heroin is actually 2 times more expensive than gold by weight. So, it's a good business, of course, but illegal and it kills people. Okay. The most potent, but pay attention, heroin is not the most not the strongest drug. The most potent narcotic substance is alpha-methylfentanyl. It is 600 times stronger than morphine. This drug is used in medicine. In reducing some very pronounced pain. We will talk about that later. Okay, so these are actually two hydroxyl groups. They easily conjugate with glucuronic acid. And morphine glucuronide has a more pronounced analgesic effect compared to morphine. So it means that if in our liver the morphine will be glucuronide, it doesn't lose its activity. It is still active. That means that morphine has quite a long effect. In the real failure especially, accumulation of active metabolites happen and with a prolonged severe anesthesia. Morphine, like all opiates, is 85% converted to the INS metabolites, which can rapidly be excreted by kidneys. But if we have the renal failure, that will not happen. Okay, what happens? 7–10% of glucuronide morphine is excreted in the bile and enters the lumen of the stomach, where it again can be absorbed into the blood. Why bile goes to the stomach is a question for me also, yes, because it is actually released into the intestine, but with not with the bile, but with the glands, the stomach glands, some amount of morphine can also be released into the stomach. Okay, so by gastric lavage, actually, this a little amount of morphine can be removed from the GIT to reduce the secondary absorption from GIT. Okay. Also, it can be inactivated by potassium permanganate. Indication for morphine is the severe pain symptoms. For example, for cancer patients, in operations sometimes with severe injuries or myocardial infarction. Because in myocardial infarction, people suffer from a very strong pain. So to stop it, we can use morphine. This is an indication. The contraindications, of course, I think everybody understands that if you have any problems with respiration, morphine will work in them. Then in paralytic, spastic, and obstructive disease of GIT, of course, because it stops the activity of GIT, so if it is already weak, we will make worse. For children and elderly people, in pregnancy, in traumatic brain injury and surgical disease of abdominal cavity. No, sorry. Get back. Where are we? And side effects. We have already discussed that we have drug dependence because of euphoria and the physical dependence because of less enkephalins and endorphins, yes. Nausea because of trigger zone, constipation because of new receptors of GIT, meiosis because of nervus oculomotoris activation, hypotension because of nervus vagus activation, respiratory depression because of inhibition of respiratory centers, smooth muscle spasm because of stimulation of M-protein receptors, mu opioid receptors in those smooth muscles. Okay, and now about the other drugs. Omnopn is a mixture of opium alkaloids. I already said that when we had this drug at the beginning. So it contains morphine, codeine, narcotic, papaverine, and thebaine. So guys, by pharmacological properties, they are similar to morphine, but due to having the isochinoline derivatives also, and these are isochinoline derivatives, especially papaverine, it has also antispasmodic effects. Guys, antispasmodic, very important. Why? Very important because morphine itself has opposite, it has spasmodic activity, and papaverine has antispasmodic activity, so together Omnopn gives pain relief and antispasmodic activity. Codeine, it's a derivative of phenathrene, also alkaloid, and it is synthesized from morphine. It has all the properties of narcotic analgesic, but compared to morphine, codeine inhibits the cough reflex to the greater extent. So it means we have more pronounced effect on cough with codeine and less other effects. So we can use that as the antitussive drug. Okay. Now about the synthetic narcotic analgesics. Synthetic, they are, for example, promedol. Trimeperidin is the original narcotic synthesized in USSR, by the way. In comparison to morphine, it has less depressing respiratory center, so it can be used during pregnancy, childbirth, and even in children. Improves the uterine muscle tone, not improves, increase the uterine muscle tone. Does yes, improve also. Да.